Hello everyone, my name is Daniel Waskiewicz,
And I'm Tara Dawson.
and we are both doctors of physical therapy from the University of Evansville. Tara and I actually graduated in the same class together, and then we both went on to join Body One as orthopedic residents. For myself, I chose to do a residency because I felt like through clinical education, I gained a lot of experience, but I always lacked that level of confidence I wanted in treating and working with patients, and I knew a residency would really force me to address my weaknesses and kind of step out of my comfort zone, and it really did exactly that, so I'm really thankful I chose to join on.
Yeah, and to add to that, I think I have a lot of the same reasons for choosing a residency. I think residency really does help bridge the gap between being a student and being a clinician with mentoring experience. For me, I was also really interested in the UND component of the residency, so with the Body One Residency, we got some experience teaching at UND, so we got to help be assistants with the program and then also have lectures of our own. So I chose the Body One Residency specifically actually after I shadowed in the clinic for an afternoon. So I shadowed one of the current residents at the time, and I kind of just fell in love with Body One that day. I really respected and enjoyed the one-on-one care that was given at Body One. As a student, I had been in clinical settings where we were seeing 2 or 3 patients at a time. So I knew for me that I really valued that one-on-one care, and I knew I wanted to work for a company that would value that as well.
My favorite experience from the Body One UND orthopedic residency was definitely the one-on-one mentorship. The awesome thing about Body One physical therapy is that every session with a patient is one-on-one, and then with mentorship, you then have a mentor in there with you, so it's just the perfect environment for learning and comfortable learning specifically. And what I really appreciated was every mentor had a little different spin to how they worked with you and how they treated, but they also really conveyed and personalized their mentorship based off of your specific learning style. So for myself, something I really wanted was to get pushed out of my comfort zone and help address my weaknesses, and I felt like I was able to do that in a really comfortable manner with my mentors working with me one-on-one, making sure I was comfortable in learning, but also pushing me away from my strengths, and I really feel like it turned me into a well-rounded therapist that I wouldn't have become on my own without that mentorship.
Yeah, and to add to the mentorship component, I think one of the strengths of this residency and why I loved it was that we had actually educational sessions every other week. So every other Wednesday we would meet, and one of the clinicians at Body One would take us through a unit, so a different body region or topic. And it was really nice to be able to learn in maybe a more laid-back setting and a more clinical spin to everything than you learn in school. So it's just kind of adding on to what you already know in school and really building on those foundational skills. We also did a lot of different projects throughout the residency year. So things like journal club, where we discussed different research articles. And Dan and I both had different projects that we worked on throughout the year, leading up to one of our final projects, which was a topic that we could choose ourselves. So we were able to pick topics that we were really passionate about. But I think overall the residency allows you to kind of tangibly track your growth throughout the year, because there is a lot of growth that happens residency year. So I think with those different projects, it kind of highlights and really shows you your growth and highlights, what your strengths are and what your weaknesses are, and helps you develop those even more.
So a normal week as a orthopedic resident through Body One Physical Therapy is kind of ever changing. I mean, we have a lot of patient care hours, which is definitely to be expected. Mixed in with that, we have a lot of mentorship, so a lot of those one-on-one sessions with a mentor. We also will have weekly round sessions, which is during our lunch break. So we'll get together as a clinic. So all 3 of our clinics will get together over Zoom, and it's a chance for us as residents to discuss patient cases that are troublesome or ones that we could, benefit from some feedback from, and we'll just have open discussions regarding those cases. So it's really beneficial for us to have that added time onto the mentorship that's already laid out in our schedule. We also will have several projects throughout the year, including some case presentations and some journal article presentations, which really helps us to stay up on top of current research, and then also present cases just in a professional and research-based manner. And we also have our time at UIndy, which I really cherished. It was awesome getting to experience that time as in a different setting in the classroom, so no longer being a student, but more into that lecturer role. And so that, 2 days a week we're usually there. And then the nice thing is when UIndy is not in session, we don't fill that time with in clinic, so that time we actually have off, which bodes really well for time to work on our presentations and other projects. So overall it was really manageable and fun.
Yeah, I think I agree. I think the work-life balance was very manageable as a resident. It's definitely more work than if you were just to be a typical clinician, non-resident. But I think that there's a lot of benefits to kind of having that extra work and helping you grow as a clinician that first year.
Ready when you are.
So I would definitely transparently recommend this residency to anyone either interested in a residency, on the fence, or just feeling somewhat unsure about the next step for them as a clinician. Whether you've been a clinician for a few years now or you're right out of school like we were. I just really sincerely believe that this last year I've gotten, honestly an insane amount of learning, an insane amount of growth as a clinician. When it comes to clinical expertise, clinical reasoning, all of that. And I honestly couldn't see how I would have, become the clinician I feel like I am now without doing this residency. So that question is easily a yes for me.
Yeah, I would absolutely agree with Dan too. I would definitely recommend this residency for anyone who's interested. I think that residency really is just the fast track to becoming a really competent clinician just in a year's time. So if you are interested in this residency, you can look at the Body One website for more information. Thank you for listening.